In the US, we have a term called SPF, and that stands for sun protective factor. So specifically, it's measuring UVB rays. As a dermatologist, I recommend that you wear sunscreen with a minimum SPF of 30. And SPF 30 protects you against approximately 97% of UVB rays. So that's a pretty good amount. But going any lower in your SPF actually exposes you to more of a risk of burning and more advanced aging. Hi, everyone. I'm Dr. Caroline Robinson, dermatologist, and welcome to Set the Tone. This is my new podcast. Basically, we're going to be a resource for all things skin, and there is a ton of misinformation out there, so I want to give you the tea on how we should really be caring for our skin. Something I hear a lot from my patients is that they only started caring for their skin later in life. Many of us were told, yes, when we were younger, that we did not have to wear sunscreen. If you were told that, that is a complete lie. I was told that as well, but I have actually a funny story about how I ended up starting wearing sunscreen from a fairly young age. I was very into beauty magazines and I was a teenager, but I was like, okay, let me just look at the 20s. What does it say I should be doing? And it said, wear sunscreen. So me in my teenage years started wearing Aveeno Positively Radiant. Yes, it's still on the market, Positively Radiant sunscreen. And I seriously think that was one of the best skin decisions I made in my youth, in my life, actually, and in my youth. And sunscreen, we'll get into it in this episode, but sunscreen is going to save you a lot of money in the future just by being preventative for so many of the things that we know that the sun does to the skin. I approach beauty and skin from a health perspective. Obviously, being a dermatologist, that's something that I'm trained on, but I also think that it has grounded me in the decisions that I make about my skin and the recommendations I make to patients for their skin. And sunscreen is one of those things. It is a skin health decision that you can make that helps prevent you from experiencing advanced skin aging, fine lines, wrinkles, uneven skin tone, dark spots, the list goes on. So let's get into it. Okay, let's talk ozone and UV rays. Just to put it in perspective, I'm going to say a word that you probably haven't heard in a long time, the ozone layer. Yes. The analogy I like to use with my patients is that the ozone layer is like the very, very thin varnish on a marble. It is so thin, and that is the only layer that's protecting us from harmful UV rays from the sun. So you see, it's important for us to add some additional layers, whether that be sunscreen, hats, protective sunwear. There are a ton on the market now, but it is important to add to that layer because otherwise it's just the sun and our skin, and that's not good. Next, UVA and UVB simplified. So UV rays come in 3 flavors: UVA, UVB, and UVC. UV rays penetrate our skin and they can damage our collagen, our DNA, and literally determine how our skin ages. I have little nicknames for you to help remember the 2 different types. UVA are the aging rays and UVB are the burning rays. So when you go to the beach and you get a little too much sun, typically that redness that you're seeing on your skin is mostly to do with UVB. Next, let's demystify SPF. In the US, we have a term called SPF, and that stands for sun protective factor. What that means is it's a measure of how likely we are to burn with that sunscreen. And so specifically, it's measuring UVB rays. As a dermatologist, I recommend that you wear sunscreen with a minimum SPF of 30. And SPF 30 protects you against approximately 97% of UVB rays. So that's a pretty good amount, but going any lower in your SPF actually exposes you to more of a risk of burning and more advanced aging. So that protection, obviously is not the same throughout the day. You've probably heard that you need to reapply. And about 2 hours, you lose most of that protection from your SPF 30. You may be able to get slightly more protection from an SPF 50, but going much higher than that doesn't afford you much more protection. So 50, I think, is a nice spot to be in, and anywhere from 30 to 50 is pretty good as well. Okay, let's talk mineral versus chemical sunscreens. This is a big topic and there is a lot of confusion. So I'm going to break it down a little easier in terms of some of the phrases and labels that you may have heard. So mineral sunscreens refer to ingredients like zinc oxide and titanium dioxide. Zinc oxide is the same ingredient in like diaper paste for babies. Okay. So, it's relatively safe, but you also know that it's chalky. And so we have heard this term a lot online about sunscreens leaving a cast, like a white cast, especially in people who have deeper skin tones. That's from zinc oxide. Mineral sunscreens are sometimes referred to as physical sunscreens, so don't let that confuse you. Mineral, physical, those are the same thing. You'll also hear them referred to as inorganic sunscreens. That's a little bit rarer, but on the other side, chemical sunscreens are ingredients that you can't pronounce, like avobenzone, oxybenzone, those types of ingredients. They are more modern formulations, and you'll sometimes hear them referred to as organic sunscreens. This has nothing to do with organic foods or anything like that. And the only time I've really heard that be used is kind of like a marketing play to sell you some sunscreen that you might not even like. Usually every year there's some of the same controversies about sunscreen, and then there's some new ones. So some of the same controversies are that it's toxic, that it causes cancer. Like, none of those things are true. There is a plethora of clinical studies and clinical data that show that sunscreen is safe, that sunscreen actually prevents skin cancer. So I think we can put those to bed. Chemical sunscreens work by absorbing UV inside the top skin layers. Mineral filters, zinc oxide, titanium dioxide, mostly sit on the surface of the skin and absorb and scatter UV, converting it to heat just like chemical sunscreen filters. Neither mode is inherently better in terms of UV protection. The main reason why I choose one over the other is skin sensitivity. So I'm talking about people who are prone to eczema, sometimes even prone to acne breakouts, and who just identify as having sensitive skin tend to do better with mineral sunscreens in general. And so that's usually like all of my patients. So you will see me, and myself and my family. So you will see me online talking about mineral sunscreens for the majority of the time, and very rarely talking about chemical sunscreens just for that reason. Of course, I just like to make things a little bit more challenging and difficult because mineral sunscreens are the ones that tend to not blend in very well on darker skin. So there are subsets of mineral sunscreens that I love. Tinted, for example, that help blend in a little bit better and give us some extra protection against visible light. One important area I want to spend a little time focusing on is sunscreens for darker skin tones and the benefits. If you have skin, the sun can penetrate your skin, impact your collagen, impact your DNA. You can burn. Every skin tone can burn, and every skin tone can get skin cancer. Now that we've established that, there are some other things that deeper skin tones may experience, such as hyperpigmentation. And that's a big one. It ages the skin, and it's something that sunscreen is very, very helpful in improving, even without any pigment products, peels, treatments. Using sunscreen alone has been shown over and over and over again to help improve your skin tone and pigment. So I think that's important. I mentioned tinted sunscreens earlier, and part of the reason why I really, really like them is because of the ingredient iron oxide, which is found in a lot of tinted sunscreens. It's also found in some makeup, but I digress. We can talk about that later. Iron oxide adds an extra layer of protection against visible light. For example, right now I'm sitting in front of a computer screen, and that's giving off blue light to my skin. And wearing a tinted sunscreen, which I happen to be wearing today, is very helpful at protecting against some of those rays. I wanted to keep things simple for you all, focusing on what sunscreen is and what it isn't, just disregarding some of that misinformation and helping you weed through some of that. And my next video will be more focused on actual sunscreen products, but you don't have to wait that long. I'm going to leave a link to some of my favorite SPF products, just everything: sunscreen, reapplication products, sprays, brushes, all the good stuff in the description. So make sure to check that out. All right, I'll see you next time.